Ah, the holidays, the most stressful time of the year. It is good to know what your stress triggers are and how well you can handle them. My name is Carla Atkins, and today I'll be continuing on with the next segment of stress management. I will be talking about what the signs of stress are and how you may respond or react to the stresses. First thing I'm going to go over what the signs of stress are, or what the stresses are. The first stress is distress, and this is the negative effect of stress. It includes the physical, mental, and behavioral signs. Some of the physical signs of distress, it includes having a lump in your throat, dry mouth, indigestion. You could be tense, you could be restless, skittish, on the go all the time. You may be sweaty, and you might end up drinking more alcohol to calm your nerves. You're very stressful. The next kind of stress, or the next part of distress, is the mental stress. This can cause you to be impatient, irritated, not wanting to take care of yourself, having a low self-esteem, poor diet, and just overall not feeling well. Behaviorally, it could lead to drug abuse or further substance abuse. So you really need to know what kind of stress you're having in order to respond to it effectively. Now, the next kind of stress, we went over the negative. Now we're going to go over the positive effect of stress. It's called eustress. And some of the signs of having eustress is being calm, maybe feeling euphoric, very proud of yourself. You're efficient. You're able to get things done in a timely manner. And it's just quite the opposite from what distress is. Okay, now that I went over the two types of stresses, distress and eustress, I'll talk a little bit about your stress response to stresses. When you're having a stress response, you're essentially assessing your situation. If you can handle the situation, your stress response won't be activated. You can behave normally with everything you're doing. There's not too much going on. The stress response is made by your body to any demand that it can't handle. So if it's outside your normal zone of activity or of what you're doing, you may, in fact, have a stress response. Examples of a stress response could be encountering life-threatening situations, having a physical injury, or being emotionally ill. But overall, the response does depend on the situation. The first response is the alarm response, and this essentially is the flight or fight response. This can happen out of terror or fear, and it's a natural response to any dangerous situation. Humans have been doing this for thousands of years, ever since we were cavemen, and we saw an animal that was ready to attack us. The fight or flight would kick in. The second type of stress response is the resistant reaction response. And in the resistant reaction response, this is a response with overall long-term demands of daily activity. It's not immediate threat like the alarm response was. So this involves protecting your family. Another example would be deadlines at work. And that would be all long-term. And you essentially would find ways to handle that in your own realm. Now, with both the alarm response and the resistant reaction response, they will cause your body to release chemicals or hormones from your brain to deal with the stress. And effectively, it will cause different symptoms in your body. Increased heart rate, elevated blood pressure, sweating. It just can do a number of things to your body. But now that you are aware of what the stresses are, distress and eustress, and how you may react to these stresses, you may you can have a better chance of minimizing your response by knowing what they are. So with the holidays among us, keep these things in mind, and I hope you can use it to good use. Thank you.